Variations in experienced racial discrimination. Issues of intersectionality. Interpersonal racial ethnic discrimination is a persistent and prevalent social stressor. Discrimination can encompass experiences of social exclusion, physical threat, stigmatization, negative interactions with law enforcement, and maltreatment in the employment or educational setting. According to intersectionality theory, social interactions, including experiences of discrimination, may vary depending on all the identities that a person holds, such as their race, gender identity, and professional role or socioeconomic class. Gender is a social status that may modify the effects of race on experiences of discrimination. Prior studies examining gender differences in experienced racial ethnic discrimination have provided conflicting findings. This may be due to qualitative differences in the types of discrimination faced by individuals of different genders. For example, women may experience more interpersonal social incivility, while men may experience more institutional discrimination, such as with law enforcement and political participation. However, other contextual factors, such as one's professional role or the community they spend time in, may also contribute to qualitative differences in discrimination exposure. The aim of the present study is to assess gender variations in different dimensions of interpersonal racial ethnic discrimination. We also examine the degree to which gender differences are further moderated by the location from which we recruited participants. We recruited 193 college students from a private university and 140 community dwelling adults from a community medical center, both located in the Northeast US. In total, 333 non-white participants from the college and community samples were included in the analyses. These participants completed the brief lifetime perceived ethnic discrimination questionnaire community version scale, a self-report measure that evaluates lifetime exposure to racial ethnic discrimination across multiple dimensions: social exclusion, physical threat, stigmatization, experiences of discrimination with law enforcement, and discrimination experienced in the employment or educational setting. First, we conducted a two-way ANOVA to examine effects of gender, sample, and their interaction on total lifetime discrimination. There was an effective sample, such that participants in the college sample reported more total discrimination than participants in the community sample, but there was no main effect for gender and no interaction of gender by sample. We then used a repeated measures MANOVA to examine gender, sample, and gender by sample interactions on the 5 types of discrimination assessed with the brief PEDQ-CV. There was a significant effect of gender by subscale, such that women reported more social exclusion than men, but men reported more physical threat, stigmatization, and discrimination with law enforcement. There was also a significant effect of sample by subscale, such that the college sample reported more social exclusion and stigmatization compared to the community dwelling sample. Results of the multivariate test revealed a trend toward significance of a gender by sample interaction. Follow-up analyses revealed a significant interaction of gender by sample only for the subscale of physical threat, such that college-aged men report significantly more physical threat than college-aged women, but community-dwelling men reported similar levels of threat to community-dwelling women. These findings are consistent with intersectionality theory and suggest that episodes of racial ethnic discrimination may vary both quantitatively and qualitatively among individuals based on not only their gender, but also contextual factors related to their community, age, occupational role, and education. These findings also suggest that unidimensional measures of discrimination may be inefficient in encapsulating differences of the types of interpersonal discrimination and emphasize the benefits of assessing exposure to racial ethnic discrimination using multidimensional measures. Some limitations to the current study are that all data are self-report and that differences among individuals of varying racial ethnic background could not be examined. Future studies may benefit from further exploring how other social status variables, such as age and education, may influence experiences of social stress and resulting psychological consequences.